Its decision to introduce child-friendly tuberculosis medicines in the country in October this year will not only lead to a TB-free generation, but higher survival rates for those that are infected with HIV and AIDS. Now, the East African nation is the very first country in the world to launch the appropriately dosed medicine for children. Kenya has a high burden of TB at least 7,000 cases that were reported among children and infants last year. To date, 1,400 children have been put on the child-friendly TB drugs.
Caregivers of children infected with TB had to crush or cut several beta-testing pills to achieve the proper dosage. It's been 2 months since the introduction of the drugs, and the TB experts in the country say they're on a path to victory against the disease, especially among children living with HIV/AIDS.
The pill burden is markedly reduced, and the compliance to both the TB and HIV drugs is much better, and there's better treatment outcomes and increased survival, childhood survival.
Among adults, mortality rates may have dropped, but the number of the undiagnosed or unreported cases remain high.
The biggest challenge remains that about 30% of the people who have the disease go undetected every year. And the danger that it poses is that these people will continue to transmit the disease. So the main approach right now is therefore to find out the people who we usually miss to detect the disease from every year and be able to put them on treatment.
TB infection and deaths prevalence in Kenya is high among men. It is this group, as well as those who are HIV positive, that the Kenyan government is targeting in its treatment and preventive programs.
In about 5 or so years, with the interventions that we put in, including right now we are doing something called TB preventive therapy. We give you a drug called isoniazid for 6 months if you are living with HIV to prevent you from getting TB. We actually are looking at a future where we will basically reduce the level of TB in among people living with HIV to the most minimal level ever.
TB treatment in Kenya is free. The Kenyan government now provides 80% of those services without donor funding, making treatment more reliable and sustainable. Sarah Kimani, SABC News, Kenya.